Good morning, everyone. I'm first going to express my thanks to the organizers for inviting me to this august discussion. I probably will be sharing a perspective, maybe civil society at an angle, but around where does indigenous knowledge systems fit. So I think this has put me on a timer, not deliberately so. But I think when we discuss indigenous knowledge, we're just going to put a historical context in that we are recovering from a legacy of colonialism, which was aimed at economic dominance with a range of institutions. But at the end of it, it was about stigmatization of African ways of life to make Western systems a hegemony. And it's always then, in discussing this, it's got to be very important to say, where are we as a country? Where does this fit in? These impacts of disempowerment impacted on our sovereignty over our own laws, our own ways of feeding and healing, and our own ontologies. This means our existential realities, epistemologies, or ways of knowing, including use of our languages as practical tools of communications and ways of being. So broadly speaking, IKS is talking to how local communities have gained knowledge over generations in their local environment. It talks to technologies, know-hows, and skills. It's very important for societies. It defines their existence and provides foundation for their beliefs and practices. Broadly, South Africa sees IKS as a catalyst for radical economic empowerment of Africa and its rural population. Quoting the former minister, Naledi Pandor, that it can also contribute to addressing the triple challenges we face of unemployment, inequality, and poverty. And so now we will understand that talking on one aspect of IKS, which is that of traditional medicine, is that this is probably one of the oldest systems. The African traditional medicine is the oldest. Africa is a cradle of humankind. And Africans have relied on these traditional medicines and traditional health practitioners to fight pandemics. And thus, in confronting such issues, becomes a very important stakeholder to consider and engage in discussions. Of course, COVID-19 has exposed inequalities that we know in our society, much more you've heard from previous speakers. It also revealed a level of empathy between the haves and the have-nots, and those willing to share. But it is not a sustainable manner. No one could live on handouts on an ongoing basis. So we do need to create a new normal that includes, amongst other solutions that are considered, placing indigenous knowledge systems at the center of recovery, reclaiming of our health and livelihoods, and culture and economy. I'm sorry, my presentation has put me on a timer. I don't know why. But this is also legal, and our constitutions allow for that. We also have a new act, which is about protection and promotion and development of indigenous knowledge within South Africa. And within the Traditional Leadership Act of South Africa, it does talk to promoting indigenous knowledge systems for sustainable development and disaster management, far more specific. where traditional communities would rely on. So what has HIV/AIDS taught us in this context? President Mandela has often said that traditional healers are accessible and acceptable and should be used as a vehicle for health promotion. And that is a very important statement. And an editorial in the journal AIDS further echoed this, that traditional health practitioners are key to scaling up comprehensive care for HIV/AIDS in sub-Saharan Africa. However, and of course, other literature further endorses this, that around TB, patients consider that healers would be useful for them as treatment supervisors. And they've been seen by healer and all of that. But HIV had a political twist in South Africa at a time when the former president had questions whether HIV was causing AIDS. It did not then assist in getting the sector engaged. Traditional health practitioners and traditional medicine then became associated with myths and HIV denialism. There were miracle cures that sprang up, some with political support, but with little scientific evidence. And so those with access to this political support would see science as slowing them, if it was not necessarily on the way. This then impacts on funding, that you can expedite research in this sector, and also militates against mobilizing the sector for a public good. We've had interventions, lastly from foreign governments, the US, notably, which we managed to gain some funding to begin to get this sector to play a role in this work. And lastly, in the province of KwaZulu-Natal, there will be probably other stories from the HSRC and others in other provinces that have done this work. And the objective, of course, was to then strengthen the relationships between the public healthcare workers in KwaZulu-Natal, developing a uniform referral system, and of course, other tools that would assist an oral tradition of traditional medicine, and of course, with the support of municipal health units. We needed to make this work relevant to the practice of traditional healers in their local environments, working at a ward level with the local AIDS council structures, and that was important. Then, of course, KwaZulu-Natal had another program, the Operation Sukuma Sake, which made this facilitation much more possible. Because there used to be no training for HIV for traditional healers, a lot of focus was on biomedical trained public health workers, medicine doctors, pharmacists, nurses. And so we put a training program integrating traditional healers in this work with role plays, bringing in biomedical information to them, not in a very top-down condescending manner, but because they see patients, they were seeing patients with HIV, so they understood the disease. They may not know have known the virus in its much detail. And so this had to be done in a respectful manner, such that they can be of help to their communities. And of course, what was interesting was that as we conducted the training, as information becomes readily available, traditional healers themselves offered themselves for HIV counseling and testing, for medical male circumcision. And those who tested positive would be put on treatment where applicable. And this was very important because this a sector probably would have not reached without this. And also they are closer to their communities and their clients. And We'll just give an example in one district during the project period where we could see that there was an increase in numbers of people being tested for HIV as they mobilize their communities and their patients, and TB detection. We also saw that condom distribution in non-health centers was on the increase. This has, of course, did receive some media attention, like the BBC and other US-based, because this was a US-based funded project coming to see and report on this. And I must probably say, when we finished training, traditional healers would come with color. We would have a graduation ceremony. We'd invite the mayor and political MECs and staff to a colorful ceremony with song and dance and much fun. Now, what did we learn from this? The first is that became important that you can involve traditional healers from the start of the project or of the epidemic in terms of leadership of government. And they had displayed tremendous basic knowledge of HIV without the scientific, but in terms of how they were seeing it at play amongst the patients and the community. And we also saw the maturity of the leadership and their willingness to participate in various structures, the war rooms, clinic committees, the ward aids councils, of course, up to SANAC. There's always been an openness to participate and be part of a solution. And that became, for us, very important signal. As you develop this relationship, working with this, and some would come to us to say, look, I have a product, I'm using it, I'm willing to have you test it. That's the words they would use. Then, of course, we involve our team of scientists to do the extraction, to do some basic science research. And amongst those, we have a program to screen for anti-HIV. This is just one example of the work we've been doing, where we can find in this, sorry, it's moving faster for me. We find that we have, of course, different fractions or different preparations where there's anti-HIV activity. And of course, we are eventually beginning to see some exciting research around issues of reversing latent HIV, and this work we are developing further now and preparing for a clinical trial. And we had already done some work with colleagues working with traditional healers who understand these products themselves, but bringing in the biomedical team to work alongside to do this double-blind randomized trials to this effect, which is exciting because we can show that we have the capacity to do these things in South Africa, involving our people and, of course, our biodiversity to that effect. So what has happened since COVID-19 has come? Clearly, we have a different administration that was not asking whether this virus causes COVID, but TAPs again complained of not being consulted, and that their role as healthcare workers was not glorified to law enforcement agencies during the lockdown, which created a problem. Because the lockdown came, you may not have enough herbs in stock to care for your patients. You need to go to the bush to get them, or you need to go to the market, local multi-markets, to get those. So pharmacies were opened, but those were informal traders offering herbal medicines were not allowed to operate, which became a problem. You're allowed to see patients who come to you, but you can't offer them any prescription to help them. It may not be any to do with COVID. So it's taken a while of protest that the Department of Health began to engage traditional healers and clarify their role in terms of COVID-19. I think we're already in level 3 by that stage when this happened. And which then led to a grudging acceptance that THP is now being considered amongst the frontline healthcare workers for vaccination. But there's a sense that this is just a public relations exercise. Government wants communities to buy into vaccines, so they want to see traditional healers playing a role there. And so it creates that suspicion. It's not sitting very nicely with them at the moment. We were talking about public community engagement, and these are elements that are not necessary, so to say, whilst we're facing a crisis. Now, you would remember early on, there was a president of Madagascar who made a claim of his country's COVID organics being a chore, and other presidents came into the scene. But there was, of course, a lack of evidence in this matter. And I think there were also calls for South Africa to help. Now, WHO, Africa, CDC, and the AU Commission stepped in to set up a panel of experts to design a clinical trial protocol similar to the Solidarity for Repurposed Drugs, to such that the research can be fast-tracked on traditional medicines and data can be shared easily to allow for regulatory bodies to do their work much more faster, given the emergency that we faced. But there's been other challenges here. Once you get presidents involved, it makes for scientific processes to be much more difficult. You want Madagascar and South Africa to work together. Do you then write the international relations, to write the ambassador that side, to get to the president? You want data to share as scientists to do the work. So sometimes it can be complicated. And I was hearing my colleague who just spoke before me that there are these protocols, there are these things. Sometimes they might be very tricky for us who are on the ground to make these quick responses to do science in the process. But it's a great initiative, and it has helped in a sense to set a baseline in terms of the level of clinical or scientific work that is required before, I guess, most of these claims are made more publicly at this stage. Of course, South Africa on its own, the Minister of Science and Innovation had made announcements that South Africa is also looking in this area. We had a meeting yesterday to present some of the progress we're doing on looking at our own indigenous plants and traditional medicines. We've set up, at the moment, is still in vitro models that we're working in to generate the early data, but we're looking at plants with a history of use for respiratory diseases or antiviral conditions. We have models that we can grow now the SARS-CoV virus, and so we can be able to test what has potent antiviral properties. And that work is ongoing at the moment. We are a consortium, including the ARC and a range of other players in this game. So watch this space because that work is ongoing. Something I thought I could mention here for our purposes was that the government of KwaZulu-Natal to help mitigate COVID-19 and complement the current biomedical interventions that are there. And so this involves a number of the departments in the social cluster, health, education, agriculture, integrating NGOs, traditional healers, the House of Traditional Leaders and other institutions, local universities involved. Amongst of those was to say there needs to be a strengthening of indigenous foods supply. In this case, the herbs that must be much more made more available, and other nutrients that the community needs to access, including, of course, exposure to the sun and playing indigenous games where social distancing is possible. And so this is a program that has been adopted alongside what other interventions are going on. But it's at least it brings the community much more closer to action on areas of things that they know would work. This talks to also agro-processing of these things, such that some of these foods are made much more available in the market for consumption and use. So the last few words I will place here are the words of the Mahatma, who once said to his people, "I submit to you that scientists have not yet explored the hidden possibilities of the numerous seeds, leaves, fruit for giving the fullest possible nutrition to humanity." And I think with our biodiversity in South Africa, we are the third most biodiverse country. We've not fully exploited this to the best that we are possible can do so. We have the healers who have the knowledge, not just the healers, our communities, our grandmothers, who have immense knowledge and that we can tap to in times of crisis as we face. What can I say? In times of epidemics or pandemics, we are finding that there are other politics that times come into play, or economic interests, which may militate against objectivity towards indigenous knowledge systems. And it's important for us as a country that we adopt an inclusive approach. Not every person is important, their knowledge is important. If it can provide a solution, we need to open our minds and look at it, investigate it, fund it, and adopt which that can be supported by evidence. I thank you very much.